With depression ICD-10 codes, F32 Äî unspecified gets used when documentation lacks detail, but a specific code is usually required for insurance claims. Unspecified depression is the code you reach for when the chart is thin, and best practice is to avoid it whenever possible. Depression ICD-10 codes explained for billers and operators. The F32 and F33 categories cover depressive disorders, single episode and recurrent. We will walk the F32 single episode codes, the F33 recurrent codes, the severity tiers, and why specificity matters. In ICD-10 CM, depression diagnoses fall under the F32 and F33 categories, mood or affective disorders. F32 is the primary category for a single episode of major depression, with specificity added for the severity and features of that episode. If the patient has recurrent depression, multiple episodes over time, you move to the F33 series for recurrent depressive disorder. The post is clear. The diagnosis and treatment plan must justify the billing codes used for services. Accurate ICD-10 coding is not just clinical, it is for insurance. A specific code reflecting mild, moderate, or severe, and single versus recurrent helps treatment planning and is usually required for insurance claims. If a goal or intervention does not tie back to a diagnosis or problem, the post notes it may be seen as not medically necessary. The post describes how, when you enter the diagnosis in the EHR, it attaches the corresponding ICD-10 code, which then flows through to billing. Select Major Depression Moderate, and the system can note F32 Äî in the plan and on claims, the post explains, keeping the code consistent end to end. Behave Health is designed to attach the code to the record, so the plan and the claim stay consistent, instead of rekeyed twice. 3 depression code families show up on most claims. Get the tier and the episode right in each, and your documentation holds up. Single episode, recurrent, and the related diagnoses that sit next to depression. Let us walk through all 3. Family 1. F32, major depressive disorder, single episode. Severity drives the 4th character. F32 Äî is mild, and F32 Äî is moderate. F32 Äî is severe without psychotic features, and F32 Äî is severe with psychotic features. Family 2. F33, recurrent depressive disorder for multiple episodes over time. F33 Äî denotes recurrent depression mild, and F33 Äî is moderate. F33 Äî is severe without psychotic features, and F33 Äî is severe with psychotic features. Family 3, the diagnoses that sit next to depression and change the code entirely. For chronic low-grade depression lasting years, persistent depressive disorder or dysthymia carries its own code, F34 Äî. If an external stressor is the primary cause and symptoms are milder, adjustment disorder with depressed mood is coded F43 Äî. Within F32 and F33, there are also other specified and unspecified codes. Reach for them last. A specific code that reflects mild, moderate, or severe and single versus recurrent helps treatment planning and is usually required for insurance claims. Other specified codes like F32 Äî and F33 Äî and unspecified F32 Äî exist for when detail is missing, but capturing the episode and severity is the better habit. The post calls it the golden thread, a straight line from assessment to plan to progress note, with the diagnosis kept in sync the whole way. Goals and interventions should tie back to the documented diagnosis, the post explains, so insurance auditors can see the linkage between the plan and the notes. If the diagnosis is major depression, F32 Äî moderate, the goals should be about alleviating that depression, not something tangential. Accrediting bodies like the Joint Commission expect the plan to include the diagnosis, goals, measurable objectives, and interventions, per the post. The post notes plans should be reviewed regularly and documented even when nothing changes. Many payers require an initial treatment plan within the first few sessions or within 30 days of admission, the post states. A common standard is review every 90 days or sooner on significant change, with reminders set at 30, 60, or 90 days by program policy. Behave Health is designed to connect the diagnosis to the chart and the claim, so the code, the plan, and the notes stay consistent as the work happens. Selecting the diagnosis is designed to attach the corresponding ICD-10 code and carry it into the plan and onto claims for consistency. The platform is designed to link progress notes to the goals they address, helping keep the golden thread intact from assessment to note. Built-in reminders are designed to flag when a treatment plan is approaching its review date, so the documentation cadence doesn't slip. Stop leaning on unspecified depression codes that thin out your claims. Book a 20-minute demo at behavehealth.com. See diagnosis to claim coding and golden thread documentation built for behavioral health at behavehealth.com.